Welcome to another video. In this video, we will continue learning medical surgical nursing starting with the intraoperative phase. This phase begins when the client enters the surgical suite and ends with transfer to the post-anesthesia recovery area. Nursing focus is on safety, client advocacy, and health team collaboration. Here is the universal protocol before surgery. Always conduct a pre-procedure verification process. Always mark the procedure site. Always perform a timeout before starting the procedure. What are the important nursing interventions during this phase? Here are actions you need to be familiar with. Implement role according to established standards. Maintain safe environment. Ensure strict asepsis. Apply grounding devices. Ensure correct tools such as sponge, needle, and instrument count. Position client. Remain alert to any complications that may arise. For example, there are diseases that increase during surgery such as diabetes, heart disease, and liver disease. Communicate with the surgical team. Now let's go over the postoperative phase. This phase begins from when the client enters the post-anesthesia recovery area and continues until discharge from the healthcare facility. Here are the following important nursing interventions you should know. As an ongoing assessment, you will need to assess the pulmonary system by verifying the airway and checking gag reflexes, access for bilateral breath sounds, and encourage coughing and deep breathing. You will also need to assess the circulatory system. This is done by comparing vital signs to baseline and assessing tissue perfusion. The next system to assess is the neurological system. This is done by evaluating the level of consciousness, assessing reflexes and movement. The next system is the genitourinary system. This is done by monitoring an input and output and assessing urinary output such as color, clarity, and amount. The next assessment is the gastrointestinal system. You will want to assess bowel sounds and signs of abdominal distension. The next assessment is the integumentary system. Here you will want to assess the color, wound, and drainage insertion sites. Once the basic assessments are done, here are the other nursing interventions that are commonly done, such as the following. Verify IV fluid type, rate, and site. Check dressings for type and amount of drainage. Identify drainage, including color and amount. If an NG tube is used, determine type and amount of section ordered. Position and semi-Fowlers to facilitate maximum oxygenation. Monitor oxygen saturation. Ensure thermal regulation. Provide pain management. Maintain NPO status until the client is alert and their gag reflex returns. Prevent complications. Transfer a discharge client to unit or home. Well, that's it for this video. In the next video, we will continue the lesson by learning about postoperative complications and interventions.